This is case of the week number 5. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 34 years old and had had one child by emergency caesarean section at 35 weeks gestation when not in labour. She was now 6 weeks pregnant and presented with brown spotting with minor pelvic pain and an HCG level of 22,000. These are the ultrasound images. To help you to orientate yourself, this is the anterior cervical wall, anterior uterine wall with the bladder out of the view, fundus, posterior uterine wall and back to cervix. This image is a longitudinal view of an anteverted uterus, and in this image we've added some colour Doppler information to display vascularity. What's the diagnosis? Is it a threatened miscarriage, an incomplete miscarriage, an ectopic pregnancy, a caesarean scar pregnancy, or a cervical pregnancy? Looking at this image, again, this is the anterior uterine wall with the bladder up here, fundus, posterior wall, and cervical canal. This white line is where the bladder attaches to the anterior uterine wall, and this denotes the level of the internal os. So this is cervix and this is uterus. In here you can see the endometrial cavity is filled with blood and blood clot. Here in the caesarean scar niche is a gestation sac. This is the gestation sac containing a yolk sac. And you can see that this white trophoblast fills the scar niche and that there's a little teardrop shape just here. There's minor peripheral vascularity, showing that this trophoblast is adherent to the myometrium. This is a video of the same case. So I'm scanning longitudinally from cervix up to uterus, slightly unusual way, but just to show you where this pregnancy is located. You can see there's the pregnancy. This is the gestation sac. This is clot within the endometrial cavity. Empty cervical canal, it's not a cervical pregnancy. There's the scar niche, the gestation sac and yolk sac. And then going up, you can see the endometrium is thin and there's clot in the cavity. On 3D, this is what it looks like. Uterine fundus is here, posterior wall, cervix, anterior wall. And you can see that this is the endometrial cavity and it is filled with clot. And this is a gestation sac bulging anteriorly in the caesarean scar niche containing a yolk sac. This was a caesarean scar pregnancy. The key features of a caesarean scar pregnancy are that the gestation sac is either in the caesarean section scar niche or on the caesarean section scar. It's often a teardrop shape into the niche. Some peripheral vascularity around the gestation sac and a negative sliding sign show that the pregnancy is attached to the myometrium and is not an incomplete miscarriage. The scar may be bulging anteriorly. And if the pregnancy continues into the second trimester, these caesarean scar pregnancies are a precursor of abnormally adherent placenta. Thank you.